He's our first patient of the day, aged 17 years, a diagnosed case of thalassemia. Very low hemoglobin. He has been on blood transfusions. He has attacks and episodes of fever post blood transfusion. Weakness is the predominant aspect for him, very weak, especially when walking. Hemoglobin levels are around 6.4, 6.5, that's the hemoglobin levels. The normal is around 12. Very enlarged spleen, with thalassemia, splenomegaly is common, so enlarged spleen. কত বছর বয়স থেকে রক্ত দিতে হচ্ছে? Since age 4.5 years old, he has been on blood transfusions. The frequency were more, but it has reduced with homeopathic treatment. He has had episodes of epistaxis in the past. Since age 4, he is having blood transfusions. He has had epistaxis in the past. নাক দিয়ে এখন আর রক্ত পড়ে? একবার পড়েছিল. He has had one episode like that in this period as well. Eyes are yellow, so bilirubin levels are also quite high. He gets frequent cold, dust causes burning in the nose. Frequent cold, dust causes burning in the nose. Recurrent episodes of loose stool which is offensive. Recurrent episodes of loose stool which is offensive. Urine is also bad smelling. His memory and concentration levels are very poor, and he is fearful of darkness as well as dogs. Fearful of darkness as well as dogs. Thermal reaction is nothing as very marked. He sweats more on his back. He sweats more on his back. He likes salty egg cold drinks. Salty egg cold drinks. Loose stools, I mentioned that, is recurrent. He can have a tendency for vomiting in the morning, especially after brushing. Tendency for vomiting in the morning, especially after brushing. কি অসুবিধা হচ্ছে বলো এখন? পেটে ব্যথা আছে? Right abdomen pain is there. I'm reading today's notes. Burning nose I mentioned from dust. বুকে ব্যথা হয় কোনখানটা? Chest pain on turning the body to either side. Epistaxis, I think I mentioned that. Nausea while brushing in the morning. Bomi hole ki beroy? Yellow vomitus. The vomitus which comes out is yellow. Angule ki hoche? Cramps in his fingers. Chul othe. Hair fall. Hair is turning reddish. That's what he says. Hair is turning reddish. Motion sickness is there. Appetite is low. I think I mentioned that. Matha ব্যথা কোনখানটা হয়? He has a occipital headache. দেখাও একবার. Vertex occiput, I'll say. কখন হয় এটা? More in the evening after he wakes up from his afternoon nap. Easily catches cold. I think I mentioned that. Debility, I mentioned that. What can be done in thalassemia cases, what we do encounter is patients are generally on blood transfusion almost every week. With homeopathy, what we can do is at least increase the duration of the blood transfusion. So, doing blood transfusion, it takes a toll on your system. He's getting fevers every time he's getting the blood transfusion. We have reduced it gradually to once a month. He has been under my treatment since 2019. So around 4.5 years. And what we have done, which was previously every week, we have reduced it to once a month. But, you understand there is a maintaining cost to it. So we try to revert it, but hemoglobin levels do tend to come down as well. The last hemoglobin levels is 6.3. That's whenever it goes to 6, they go for a blood transfusion. देखिए beta thalassemia was the diagnosis. In thalassemia, the HbF levels are high. You can see in this report as well, the fetal hemoglobin levels are high. As he has been under treatment for a long time, there are quite a lot of remedies which has been used with him, considering the existing symptoms. I'm sharing with you the remedies in order. We had started in his case in 2019 with Calcaria Fos. There were Calcaria symptoms in the case. Didn't help much, to be honest. We had gone up from 30 to 1M, but didn't help much. We had gone to Syncona after that with the weakness, with the anemia. Syncona again helped to a certain extent, but there were recurrence of symptoms. One of the remedies which helped after Syncona, I want you to have a look in your boriche please, is TNT, trinitrotoluene. TNT is a remedy which helps such cases of hemolysis. Have a look in your boriche please, TNT, trinitrotoluene. Boriche, TNT, trinitrotoluene. You got that? If you read second paragraph, destructive action of TNT on the red blood corpuscles is responsible for the anemia and the jaundice. So you see the pathological combination here, anemia. You look at his eyes, very yellow. So the combination of anemia and jaundice. Trinitrotoluene, TRI. You got that? When he's there, you can palpate the spleen as well. Spleen is hugely enlarged. If you want, you can palpate the spleen. Hemoglobin is changed so that it cannot act satisfactorily as an oxygen carrier. As a result, we have breathlessness. So you see the manifestation of the anemia with him, breathlessness. You got that? Dizziness, headache. He has the dizziness, the weakness, the headache. You got that? Undue fatigue, drowsiness. So undue fatigue, dizziness and fatigue. So it works in cases where there is hemolysis, breakdown of the blood, resulting in weakness, fatigue, dizzy, drowsy. You can think of a picture like Thalassemia, but you understand the pathology is entirely on the cardiovascular plane. The pathology is entirely on the hematological plane. So dizzy, drowsy, all those words are written there. Dizziness, drowsiness, headache. But the reason for that is the combination of anemia and jaundice. You're with me? You see, you have to understand as well, when you look at these symptoms, they are common symptoms. Like if you recall, I shared the hydrestis yesterday with you. But when you put them together, and that is together as a symptom complex, when they coexist together in the same personality, in the same constitution, with the pathology of anemia, with the pathology of hemolysis, it becomes a characteristic for this remedy. You understand what I mean? So that's very important for this remedy, trinitrotoluene. It's not available in many potencies. We use 30, 200 and 1M, and that was it. We couldn't get 10M after that. But he had shown a lot of improvement with TNT. The frequency of blood transfusions has been better with TNT. His dyspnea has been better with TNT. You're with me? Please put a note for this remedy for cases, not just thalassemia, but cases of anemia, undefined anemia, when you're not getting any diagnosis for that, with these manifestations. The dullness, dizziness, drowsiness like Thalassemia with the headache, but the pathology is on a hematological plane. If you see even in the head section, aversion to company, apathetic, faintness, dizziness, very close to Thalassemia. The apathy like Thalassemia, the dizziness like Thalassemia. You got that? The Thalassemia, we understand, is vastly different considering the sphere of action.
Even it is mentioned when the skin or hair is exposed by contact, a characteristic yellow, tawny, orange stain is produced.
Where is that?
Generalities, second last, third line. Third paragraph, second line.
Sorry, could you read that line?
When the skin or the hair is exposed to TNT by contact, a characteristic yellow or tawny orange stain is produced.
So, you know, that happens many times with such hemolysis as well, the reddish color of the hair. Reddish color of the hair. So that can happen, yeah.
How did you come to this? Because this is a very small remedy. Is this from memory or you were looking at...
No, I learnt as a clinical tip that it helps for cases of anemia. But it corroborated because, you know, he had this dizziness, he had this weakness. And I also remember it whenever, you know, Thalassemia-like symptoms with an anemic background. You understand? The dizzy, drowsy, apathy like Thalassemia. Dizzy, drowsy, apathy like Thalassemia. But with a hemolysis or an anemic background.
Are there too much people like this in India? Thalassemia.
Quite a lot.
They don't make this test. Pregnancy, before pregnancy.
They do, you know, but you have to understand he's coming from 500 miles from here, which is a very rural area.
But too much is Cyprus before, too much people.
Yeah.
Nowadays, much
They do in the cities, they do in the urban areas, but it's still not prevalent in the rural areas. কোথা থেকে আসছো? মুর্শিদাবাদ তো? কবে বেরিয়েছো? কালকে? কখন? কটা নাগাদ? They left home 10:30 p.m. last night to see you today. So they're traveling a long distance and it's unfortunately not prevalent there to do the prior pregnancy test there. But that's the way it is. TNT helped to a good extent, but another remedy which is on now and which is also helping is Ferrum. I want you to remember this remedy. It works wonderfully in cases of splenomegaly, splenic enlargement with anemia. You understand Ferrum is greatly anemic, right? If you highlight the Ferrum and arsenic symptoms in the case, what are the arsenic symptoms? Sorry? Weakness, I'll say yes, number one.
Fear.
Offensive discharges, right? I think I mentioned that something is offensive. Stool is offensive, breath is offensive, urine is offensive. So offensive discharges. The Ferrum aspect is anemia. Okay, I'll take that, yes, desire egg. But if you open Ferrum Ars in Boric, I think it's in the relationship of Ferrum Met. Relationship of Ferrum Metallicum. One of the major aspects of Ferrum Ars is splenomegaly. So cases of hugely enlarged spleen, Ferrum Ars can respond really, really well in such cases. He started with Ferrum Ars 30C, his last prescription was 200C of Ferrum Ars. You got that? Boric relationship of Ferrum Met, Ferrum Ars. It mentions enlarged liver and spleen with fever. And he has those episodes of fever post the blood transfusion. And you understand arsenic also has a tendency for periodic fevers. Complaints return annually in arsenic. Periodicity in arsenic is present. So lots of weakness, bad smelling discharge, periodic fever, that's the arsenic component. Ferrum is obviously the anemic component, but what will guide you towards Ferrum Ars is a huge enlargement of the spleen. Right? দেখি পেটটা একবার তোল বসো 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 spleen still has a 3-finger enlargement, still quite enlarged. Few organopathics I'd like you to take a note, please, which can help in such cases. Especially, when the hemoglobin levels come down, when the weakness is predominant. I want you to open Boricae, please, and put these in your clinical tips for splenomegaly. Number one is Tinospora cordifolia. Tinospora, Tinospora. Anyone used it? Tinospora? Have a look in Boricae. It's in the relationship of Cyanothus. Relationship of Cyanothus. Ceanothus, relationship of Cyanothus. Cyanothus, we'll talk about that as well. That's also a remedy for splenomegaly. In the relationship of Cyanothus. This is a typical picture of Tinospora, which you can use as an organopathic. Weakness. Tinospora, my friends, is known as a pick-me-up remedy. So it's so weak, cannot get up from the bed. So you need someone to pick up from the bed, and that's Tinospora. Pick-me-up remedy. So weakness, what you have with him. Recurrent fever. You see the line in Boricae, relationship of Cyanothus, is a Hindu remedy for cases of fever with enlarged spleen, something like that. Hindu remedy for cases of fever with enlarged spleen. So splenomegaly, recurrent fever, but weakness is the main aspect. Lots and lots of weakness. Please put a note. It's a pick-me-up remedy. So weak I cannot get up from the bed. I need someone to drag me up from the bed. You got that? So cases of anemia like him, with the weakness, with recurrent fever. Anemia with weakness, with recurrent fever. It's there also in the main in the relationship of Cyanothus as well. A Hindu remedy for cases of fever with enlarged spleen. That's Tinospora cordifolia. So a case of weakness with splenomegaly, with the recurrent fever. That works wonderfully for Tinospora cordifolia.
Cyanothus is an alternative. I use this. It's alternative or there is indifference?
Sorry, I'll come to Cyanothus in a moment. I'll come to it. So you got the points for Tinospora, everyone? Fever, enlarged spleen, weakness, anemia is obviously there because whenever spleen is enlarged, anemia. You can use it in the Indian subcontinent for cases of malaria, cases of dengue fever, and obviously any case of anemia where there is a little bit of splenic enlargement.
Cancer cases?
Can be, yes, can be as well. Say lots of weakness, fever is recurring again and again. Yeah. Even if you do not have the splenomegaly aspect, even there is lots of weakness and a case of recurrent fever, Tinospora can help A, to take care of the weakness, B, to break the cycle of the recurrent fever. So do not limit it in your thought process that it's only a remedy for splenomegaly, no. But cases of weakness with recurrent fever, Tinospora can handle such cases as well with aplomb. You got that? So that's Tinospora. Number 2 in this list of splenomegaly is the remedy which is in its relation, Cyanothus. Cyanothus, my friends, will always have a dragging pain in the left side. The spleen is so much enlarged that there is always a dragging pain in the left side, Cyanothus. You got that in Cyanothus? Dragging pain in the left side. Abdomen, deep-seated pain in the left hypochondrium. Deep-seated pain in the left hypochondrium. That? Yeah. Pain up all the left side, deep-seated pain in the left hypochondrium. You got that? Very, very dragging, lots of dragging pain in the left side. Right? The third remedy in this list for splenomegaly is Quercus. Quercus. Quercus glandium spiritus. Quercus glandium spiritus. It's your remedy for alcoholism with splenomegaly. Alcoholism with splenomegaly. But the main characteristic of Quercus, Burnett mentions this, is his fecal smell of the breath. Breath is very, very bad smelling, stinking smell of the breath. Alcoholism with splenomegaly, where the breath smells like feces. Very, very stinking breath. That's the characteristic of Quercus. You got Quercus? Used first by Redmaker for chronic spleen affection, spleen dropsy. That's the first line in Quercus. Takes away the craving for alcohol, so alcoholism. But the major characteristic, Burnett or Clark will mention that, is the stercoraceous breath or fecal smell of the breath. Very offensive. It's not mentioned Boricae, but put a note there. Very stinking breath in Quercus. Okay. And I'll finish up this list with my number 4 is Chionanthus. Chionanthus is also a remedy for splenic enlargement. Splenomegaly. We have 2 C's, Cyanothus and Chionanthus. And these all you can use as an organopathic in tincture or a 6C. With Chionanthus, one of the features is a sick headache, a bilious headache, a sick headache, which is there generally associated with the splenic enlargement. Last blood transfusion was on 29th of January. We are going to a Ferramars 1M today. Ferramars 200 had been prescribed twice. We are going to a Ferramars 1M today. And I've given him Tinospora as an organopathic for acute phases of weakness. When the hemoglobin gets down, he can feel it by the weakness increase. So he takes the Tinospora so that we can defer as much as we can the blood transfusion. So you see, organopathics does help in such cases where there is a maintaining cause and it's not possible to completely revert the pathology. Ferramars 1M today. TNT, Ferramars, these have helped him. So please put a note.